Okay, welcome. Good morning, good afternoon, good evening for wherever you may be. This is David's Rabbit On channel. It's sort of working with my Bacon and Bourbon channel and the On the Lounge with, so you can check those out. I'll try and put the link down here. I don't know how to do that, but I'll try and work it out. What this channel is about is I'm just going to literally rabbit on about things that have been happening that I feel I want to rabbit on about. Really, that's about it. So the session today is going to be based on an experience I've had recently in the medical area of where I'm living. And before I say anything negative, I really want to state that we truly are in one of the best countries in the world, I believe, for our medical services. We have a fantastic public health system that a lot of people say is free, but please be aware that it isn't free. We're actually paying for our health services through what's called a Medicare levy. It's actually put onto our taxes, and in some way, shape or form, at some point the Australian people pay for what is deemed or cleared seems to be a free medical service. But please, those of you who have better information and knowledge, correct me if I'm wrong. But as far as I'm aware, our Medicare levy, which is reasonably high, pays for all of our free medical services. So with that being said, last week I hurt my back, and thank you for your concern and compassion. You know, really, it's fine. But I called an ambulance. Now, I live in a rural part of Queensland, like just above the Sunshine Coast, and it's part of the Fraser Coast Shire, which is a little bit, I guess, like a county in America, and I don't know what it is in Europe. But the Fraser Coast Shire has a hospital in a town called Hervey Bay. Now that hospital serves all of Hervey Bay and Maryborough and surrounding areas, so quite a large population goes to that hospital. And I believe that the Shire Council doesn't have responsibility for the hospital. I believe it's the Queensland government. But again, I don't know. I'm just talking because I've had this experience, just rabbiting on. But I called the ambulance, and I'm now 20 minutes away from the nearest hospital, which is in Maryborough. And I got a paramedic call me back and say, "What's going on?" I explained what was going on. He goes, "Oh my God, I'm going to escalate this to a lights and siren ambulance call, which means it has priority." So I went out and waited for probably an hour and 45 minutes for the ambulance to arrive. Now that to me seems excessive, given that I'm only 20 minutes away from the nearest hospital. But when the ambulance people arrived, and there was a trainee and two paramedics, absolutely fantastic people, got nothing bad to say about them, like, at all. The problem for me was that they actually came from Hervey Bay. Now Hervey Bay's a 50-minute drive on a good day from where I live. So the ambulance was coming from 50 minutes away, and I would have assumed on lights and sirens that would have been, give them an extra 20 minutes on top of that. They would have been here just over an hour, but there was an extra 45 minutes maybe on top of them arriving. You know, give them a little bit for that. Okay, don't understand why, but anyway, it was. They then asked me where I wanted to go, and obviously the answer to that was the place that can give the best care, and then they said Hervey Bay. So I then drove to Hervey Bay in the ambulance. Fantastic care in the ambulance, like really compassionate and kind people. Was dropped off at Hervey Bay, went through the triage process, and given that it was a spinal injury, I would have thought that would have been relatively high in the to be seen list. Now I think I probably got to the Hervey Bay Hospital about mid-morning, so about 10. Called them at 10 to 7. They arrived an hour and a half later, 15 minutes in. Yeah, probably mid-morning I was in the hospital. Was taken off the gurney, put onto a chair, a wheelchair, and taken into the emergency room, where I was triaged and then put into the waiting room. And I was in the waiting room until probably 1 o'clock, so we're there probably 2 hours already, before I was seen by a ER or an ED, as they called it there, a doctor, who prodded and pushed and asked some questions, then wheeled me back out to the waiting room. And maybe 45 minutes after that, a nurse comes out and says, "Have you had any pain medication?" Now, in the ambulance, I had morphine, which was pretty good. But we were now probably 3.5 hours since the morphine, easy 2 and a bit hours since being in the hospital, and I got a ibuprofen medication, which is an anti-inflammatory and slight painkiller. I think it was probably another 2 hours after that I was finally moved from the waiting room. It's like sitting in a chair, like with one bit of painkiller, sitting in this chair before I was actually taken into the short stay bed accommodation area where I was to be seen again by doctors / physios or whatever. And I was in there, and the nurses came through and they gave me my pulse rate and my blood pressure scans on a regular basis, which I was grateful for. Temperature. Probably, I think maybe another 2 hours or so I got a bit more painkiller, which was in their timelines, which is fine. But I wasn't seen by a doctor again until 9 o'clock at night. And then they said, "You're staying in, have some more painkillers, go to sleep." Which of course you try and do if you have major back pain. And I went to sleep, obviously through fatigue. Checked maybe once during that night, and maybe then got a painkiller at 2 or 3 o'clock in the morning. I wasn't checking the time, but it was a long time between visits. Get a physio visit me in the morning, give me some exercises, push my back a little bit. Didn't do much testing. The doctors came in and I said, "Look, is there something you can do to make this so I can find out what really is going on, like an MRI, to go further into the detail of what was wrong with my back?" And they said, believe it or not, "No, we don't have an MRI machine in the hospital." So I guess a long-winded story, again, which is why I'm rabbiting on, about the fact that a regional hospital in Queensland, like just north of the Sunshine Coast, doesn't have an MRI machine. Now, that's not their fault. Obviously, it's not the Council of Hervey Bay or the Fraser Coast Council's fault, but it's the Queensland government or whoever supplies these medical machines to a regional area that services a lot of people. And bear in mind, please, that the Hervey Bay regional area, like the Fraser Coast regional council area, is predominantly mature age and retirement age people. Now, these people are going to have back issues. These people are going to have knee issues and hip and shoulder issues. And you would think that a community that is primarily retirement age would have an MRI. The Queensland government or whoever doesn't supply the Hervey Bay Fraser Coast Hospital with an MRI machine should be embarrassed. Now, they absolutely should be embarrassed. To the point that after I came home, sent home, "You'll be fine, harden up, princess," the next day after I got home, it went ballistic again. The back was all over the place. I then had to drive, and I wasn't going back to Hervey Bay Hospital because I know not their fault at all, because again, the people were absolutely fantastic. The facility was absolutely useless for the MRI for my injury. Maybe good for other things. I was in the car for 2 hours to drive down to the Sunshine Coast University Hospital to be treated not quite the same. At least they gave me a CT scan, and they prodded a little bit more and went a little bit more in depth to the problem to say that I had another bulge instead of the one that I had previously. It was something that you're going to have to maintain and look after, so they were better. They had an MRI, but they didn't believe it was needed to have one. Again, going back to the Hervey Bay experience, they didn't even do a CT scan to try and see what the problem could have been. Now, if they had done that, they would have given me slightly different exercises and a more way of managing and maintaining the pain, which would have saved me then going to Sunshine Coast. Anyway, the rabbit on here is the resources that should be sent to a regional hospital for care wasn't done. It's put elsewhere. Now we've got this is another video for another day, but the resources sent that should be gone to our regional care has gone to immigration. And we've got, I don't know how many new immigrants, and please don't take this the wrong way, I think immigrants are great if they can contribute to the society that they are migrating to, i.e. the Australian environment and the Australian community. They just don't contribute. They come, they just leech off the system, they take Centrelink payments, which is like social security benefits, they get housing benefit, priority housing over Australian people, which is, I'm going to rant that into another rabbit on in another day. Needless to say, my issue today is simply that the resources that have been put elsewhere in the community to what I believe to be wrong areas should be put into the regional hospitals, so that our regional hospital in the Fraser Coast Shire Council area, the Hervey Bay Regional Hospital, gets a stinking MRI machine. So then they can, in an emergency case like I was presented with, where I can't go to a private hospital, the waiting list to get an MRI is, this is the process, go to the GP, which takes 2 to 3 weeks to get into. They refer you to a specialist can take anywhere from 2 to 6 months to see. They then book you into an MRI, which could take you 2 weeks to a month to see, then to go back to the specialist for another appointment. We're looking at a year to even get an MRI referred to, seen to, have anything done with. And if the regional hospital had an MRI machine, in an emergency case like mine, they could have diagnosed something so much faster. And I think that's where the rabbit on's going to end for the day. So I actually want our community to understand that our healthcare system is fantastic. I'd like the other countries to understand, if you ever see this, that our medical care isn't free. Our public health system, even though I don't pay, we pay through the Medicare levy, through our wages and whatever else comes through our taxes. So we actually pay for our healthcare. Please don't think that it's free like some Americans believe. It is a paid for system by the individual that appears to be free when you visit them. Now, of course, it'll take longer to get seen, but this regional facility and servicing a lot of people should have a MRI machine. Guys, do the deal, like, subscribe, share, whatever. Sharing is important with this one because I think it needs to go to as many people as you can to try and get some voice out there, so that the Queensland government or whoever supplies this MRI machine to regional areas bloody supplies their MRI machine. There's my rabbit on going, I can't speak now. So guys, thanks for looking. Again, do the same, like, share, subscribe, and I'll rabbit on. Probably my next one will be immigration, like everybody else is doing. But let's rabbit on anyway, guys. Peace, love, and mung beans. Have an awesome day. Speak to you soon.